to a brand new state-of-the-art brain and mind care facility here in Chennai. Brain stimulation to psychological therapy, Ayurveda to yoga, cognitive stimulation to naturopathy, physical, occupational and speech therapy, we are the pioneers and innovators of integrative care for the brain and mind.
Welcome to Buddhi Clinic. Neuropsychiatry as a specialty is one that affects the brain and mind interface. And when we say brain, we know we have an organ there. But when we say mind, we touch our hearts, we touch our heads. The mind is really just the software in our brain, the millions of nerves talking to each other through chemicals. What do we have in our armamentarium to treat these patients? We have surgery for some, medication for many, if not most. But beyond all that, what do we have? And what we do have is rehabilitation, therapy, and care. Now, usually a person with a neuropsychiatric condition will have to go to various places in order to receive these treatments. Imagine if you could get all of them under one roof. Imagine if you could, just by traversing floors, meet experts in every one of these disciplines who are programmed, prepared, and equipped and qualified to help you. And that really is what we offer you here at Buddhi Clinic. The opportunity of blending modern science and ancient wisdom, the opportunity of being able to receive a very wide array of care treatments that can help you. So do come, visit, see what we have on offer, and I'm sure you will not be disappointed. In fact, I'm sure you'll feel exhilarated by what you see here. Thank you.
The basement houses the state-of-art neuromodulation facility. We have repetitive transcranial magnetic stimulation, transcranial electrical stimulation, which comprises of TDCS, TSES, pulsed and random noise stimulation. We have transauricular vagus nerve stimulation. Along with the neuromodulation, we have yoga and mindful suite, as well as the mind labs, where we are following the traditional as well as the modern way using the computerized models of assessment and therapy.
Welcome to the Neurodiagnostics Lab. So this suite is well equipped to run all our electrophysiological assessments. So here we do the EEG, the nerve conduction studies. We also run the autonomic tests. And here you can see the tilt table, which is used to do part of the autonomic testing. This suite also has a state-of-the-art sleep lab. It's a very comfortable space where patients with sleep disorders have an overnight polysomnography, that is the sleep study. So you can see that this is a suite which is very well equipped to run all the neurodiagnostic tests for patients with neuropsychiatric disorders across the lifespan. Welcome to our advanced gym facility on the rehab floor. Here we have equipment which is customized to address physical disabilities for patients with Parkinson's disease, for stroke, for traumatic brain injuries and various other neurological disorders which cause a lot of distressing physical disabilities. These are our mobility lab suites, a part of the rehab floor. And here our well-trained and expert physical therapists deliver interventions such as electrotherapy, manual therapy and exercise therapy for patients with pain, balance and posture issues and autonomic symptoms, among various other physical symptoms of neurological disorders. This is our Dr. Deepa Krishnan Neurodevelopmental Therapy Suite, and here our physical therapists work with children with neurodevelopmental delays. On the rehab floor, we have the speech and language therapy suite, where our speech and language pathologist delivers speech interventions and swallowing maneuvers to children, adults and elders with speech and swallowing disorders. The second floor is dedicated to holistic care. So we have the complementary and alternative medical treatments. So here we have 2 dry therapy suites where we do acupressure, reflexology and meridian massage. And here we have 3 wet therapy suites where we do treatments with medicated oils, powders, with foments, and we use mud packs, after which the patient can go across to the bathroom and have a bath. And these treatments are used for a host of physical, cognitive, and behavioral symptoms which are very common in neuropsychiatric disorders.
Good evening, everybody, and welcome to the Hindu's Wellness series presented by the Buddhi Clinic. Today's webinar is on a subject that's increasingly being talked about lately, integrative medicine, and specifically its potential in mental health care. Let me start by welcoming our panelists and introducing them to the audience. Our first panelist is Professor Bhushan Patwardhan, who is a National Research Professor at the Ministry of Ayush, Government of India. He is the former Vice Chairman of the University Grants Commission and Distinguished Professor, Interdisciplinary School of Health Sciences, Savitribai Phule, Pune University. Professor Patwardhan is an academician with over 40 years of experience in higher education, scientific research, and institutional governance. He has over 14,000 citations to his credit and is a distinguished fellow of both the National Academy of Sciences and the National Academy of Medical Sciences in India. He also serves as an adjunct professor at Western Sydney University in Australia and is co-chair of the WHO expert group for the Global Centre for Traditional Medicine and the first Global Summit on Traditional Medicine. He has also been involved in policy-making committees and task forces for organizations including the National Knowledge Commission, Planning Commission, Niti Aayog, and the WHO. He is a recipient of several orations and awards, including the Sardar Vallabhbhai Patel Award and the Sir Ramnath Chopra Oration, among others. Our second panelist for the day is Dr. B. N. Gangadhar, who is a Professor Emeritus at the Department of Integrative Medicine at NIMHANS in Bangalore and a National Distinguished Scientist at the Department of Ayush. Dr. Gangadhar is a Fellow of the Indian Psychiatric Society, of the National Academy of Medical Sciences, of the Royal College of Physicians, Edinburgh, and of the Indian Academy of Sciences. He is a recipient of numerous awards, notable among those being the Sir C. V. Raman Award for Medical Sciences from the Government of Karnataka's Department of Science and Technology, the Dr. D. S. Raju Memorial Oration Award from the Indian Psychiatric Society in 2001, and the Doctor's Day Award from the Department of Medical Education, Karnataka. Dr. Gangadhar has published over 450 papers in scientific journals, in addition to articles in newspapers, chapters in books, and other publications. Our third and final panelist of the day is Dr. Ennapalam S. Krishnamurthy, who is a behavioral neurologist and neuropsychiatrist, the founder of Buddhi Clinic and the NeuroFit Foundation. His work is in the area of integrated and holistic care and rehabilitation for the brain and mind. He has taken on multiple international leadership roles in the clinical science and treatment of epilepsy, dementia, neuropsychiatric disorders. He is the immediate past president of the International Neuropsychiatric Association and the editor of the Global Approach series for Cambridge University Press and Neuropsychiatry Across Cultures for the Oxford University Press. He has over 70 scientific papers to his credit, as well as over 30 book chapters, over 25 articles in the press, and has lectured in several countries. He is also an adjunct professor at the Manipal University and the Public Health Foundation of India, and serves as a senior clinical advisor in neurosciences for the Apollo Hospitals. Welcome, panelists. Let's start with our presentations for today. Professor Patwardhan, may I request you to begin?
Yeah, thank you, Hindu, for this webinar. It's a wonderful initiative which you have taken. Vanakkam. Today I am in Chennai and I visited Buddhi clinic. The seminar topic, if you see, you will find two words there. One is about integrative medicine and the other one is about health. I will quickly talk to you about both these terms, health and medicine, because somehow in our mind, we have a tendency to equate these words. We try to use these words as synonyms. Health is different and medicine is different. We'll see quickly what this is about. Let me first talk to you about how all this evolved. One Earth, you might remember that in 1972 at Stockholm, this was talked about and the term sustainability came in there. Then we talked about health for all, which WHO at Alma-Ata resolved that there should be health for all. This was in 1978 and since then, in 2030, we talked about Sustainable Development Goal by 2030. This was Paris Convention. So if you look at all this, you will see that from primary health care of WHO to Sustainable Development Goals, we have been changing the names. However, the basic problems have remained the same. At the same time, health is something very, very different. When we lose health, we need medicine. Health should not be outsourced. Health should be our own responsibility. Health is not just merely absence of disease or absence of pathology. And healthcare is not sick care, and health cannot be achieved by taking medicine. We have to work for it. We have to really take efforts to remain healthy. You will be surprised to know that over 50% of our population is deprived of health services if we talk about global view. And universal health coverage, therefore, UHC has become one of the prominent goals in Sustainable Development Goals 2030. However, universal health care is possible when healthcare is aligned to our own culture and our own traditions. If you look at the Sustainable Development Goal, the Goal 3 talks about good health and well-being. What does that mean? Sustainable Development Goal 3 has 13 targets, but you will be surprised that out of these 13 targets, not a single one is focused on mental health. And I must tell you, mental health has emerged as one of the major challenges in the world. However, mental health has not received that kind of a prominence, and the awareness about mental health is still lacking. And therefore, the work that I saw at Buddhi Clinic, I was very much impressed because mental health has to be on center stage now. The way in which the new age is evolving. On one side, huge technology developments are happening, be it artificial intelligence or machine learning, virtual reality, space missions, CRISPR technology. But while this is happening on one side, there is a big disconnect. And we have already reached from Holocene to Anthropocene epoch. What does it mean? Anthropocene epoch means human-made activities are dominating this planet. And we see all these changes which are happening around us are consequence of that. But at the same time, these technologies are giving us a very big potential and they have big potential. But at the same time, I must tell you that the confluence of modern science and ancient wisdom, this can bridge this gap between the what disconnect we talk about on one side technology, but still many of our problems are not being solved. And the situation is getting more and more worrying as far as environment and ecosystem of this earth is concerned. So we are actually facing what we call it an existential threat. And this threat is emerging essentially from greed. And if you look at some of the examples which are going around, what have happened to the humanity? This is the question we should ask. And many times we ask this question that who is driving science? Is it business that is driving science or profits driving science? Or science should be of people? science should be for the global good. That is what is the basic expectation from the science. But the hubris and the ego and the greed, which is growing around, is causing this kind of existential threats. And you see the different voices which have come from different parts of the world. So essentially, health, well-being, and good health. What do you mean by good health? First of all, we don't know exactly what good health is. But the best definition of good health, I will say that Ayurveda has given the best definition of health. Because health is not just merely absence of disease. Health depends on 4 determinants of health. They are like 4 pillars. And these 4 pillars of health, any one pillar, if it becomes weak, then you require some kind of a support system. And that support system is medical care. So 4 pillars are genetics, nutrition, lifestyle, environment, which also includes social factors. And here the role of behavioral sciences, mental health comes predominantly. So medicines treat diseases, they don't give us health. And health is not absence of pathology. These 2 things we must remember. Health and healthcare and medicine, health is attained through particular efforts of individuals. Doctors treat diseases, but they cannot give you health. So we cannot say that we are outsourcing our health to doctors. It is our own responsibility. Our health should be in our own hands, and healthcare should not be equated with medical care. Mental health challenges, if you see, it's really worrying. The economic loss due to mental health conditions is estimated to be between 2012 and 2030. This time span, if you take, it is estimated to be some trillions of dollars. So it is really something which all of us should be worried about. But at the same time, when the problems are growing, if you see what kind of resources are being used, it is under-resourced. The whole sector is under-resourced, and we need to give more attention, more resources, and more support. On one side, country like India, which has a very strong family system, we are losing that system. And you will see that blindly we are following the Western world, Western culture, when our own culture is very rich, and every culture for them is rich. For Western culture will be rich for them. We have our own culture, and we should really be caring for it, for family and our values. Because if we lose that, look at this, what has happened in America. 2023, US Surgeon General has issued an advisory, and they are calling now the loneliness has become an epidemic. By 2030, 1 in 6 people in the world will be aged over 60. And then what will happen if loneliness, an increase in old age home is not a good condition for healthy nation. So these are the issues. So we have to act before it is too late. You will be surprised. I was shocked to see this report. Center for Disease Control, which is one of the largest conglomeration of high-level scientific research laboratories in America. CDC released report last year in February. And what that report said, 60% girl students going to school are feeling hopeless. What does it mean? 30% of them have drank alcohol every month. 20% of them have experienced sexual violence. Where the society is going and what we are following, to whom we are following, we have to really pause, think, what are we doing and where we are heading? Can business and profits linked to sufferings of people be sustainable? This is a question people are raising. And medical overuse, most of the top journals are raising these questions. And they're saying, choose wisely. Less is more. Less medicine, if you give, it will be more effective. Too much of medicine we should avoid. And so here, the role of traditional medicine, conventional medicine and traditional medicine, as well as mental health is becoming very, very important. So essentially what we are talking about, one planet, there should be one health system. The silos of medicine should be dissolved. Conventional medicine plus traditional medicine will emerge as future of modern medicine. And there are pathological interventions, pharmacological interventions, but physiological interventions and psychological interventions to me are even more important, more affordable, and they play a major role in prevention. Therefore, yoga, Ayurveda, or Zen, Tai Chi, all these acupuncture, these are naturopathy, these are the various interventions which play immense role in regaining health, not just treating diseases. And today in Chennai, we saw glimpses of it, hopeless cases which actually people have lost hope. Within 2 months of time, we met some of the patients here, and I was very much impressed the way in which the holistic approach, if you take, what kind of results we can get. So this integrative medicine approach for mental health is very important, and that kind of a role model has emerged in Chennai, and I hope that this role model will get into other parts of our country and also to the world, so that more and more people get benefit of this integrative approach to medicine. Yoga and Ayurveda remain our strength. Siddha remains one of the greatest strengths of this region. Siddha also has contributed tremendously for health of this region. But why it should remain regional? Why Siddha can be used? And in Corona, we saw Siddha has given a lot of benefits to a lot of people. So take best wherever it is available and put patient at the center. And don't worry about our own terms and our own egos. Give whatever best we can give to the patient to regain health and to maintain health and to prevent diseases. Thank you very much. Again, thank you, Hindu, for this opportunity.
Thank you very much, Professor. That was a very enlightening presentation. Moving on, let's move to our next panelist, B.N. Gangadhar. If I could request you to present.
Thank you. Thank you so much for calling me to this webinar. My predecessor has spoken about the importance of integrative approaches. Here I am demonstrating one of such approaches with evidence as an example how we can start integrating some of the traditional systems into our mainstream mental health care. I have taken the example of yoga, mental disorders, with respect to one of the common disorders, that is the depression, and one of the severe disorder, that is schizophrenia. I'll just illustrate with some of the experiments that have emerged in the recent years. Just to give an introduction, people have made pluralistic choices. And what is important is, in one of the surveys, 80 to 85% of the people said they used one of the alternative approaches or complementary approaches, but did not disclose it to the mainstream conventional medicine doctor for various reasons. So it looks like a part of the treatment that they are approaching to is perhaps not regulated or did not want to divulge. And so is the case even in the more recent survey done almost 20 years later. The common explanation they gave is the complementary and alternative medicine approaches actually empowers them, they make them participative, and they ensure that they have the better self-esteem that they corrected themselves. So these reasons people make pluralistic approaches. And in a very recent study that was done in one of the medical colleges, very prestigious medical college in Delhi, the students were asked whether they would like to have some of the complementary systems to be introduced, the Ayush system, for example, in their modern medicine curriculum, and majority agreed that it should happen. And this issue has gone on to be published in some of the very, very impact-making journals. And today, the pluralistic approach has come to stay. Integration needs to happen. But how do we roll it out in practice is a challenge that we need to overcome. Two approaches have been done. Of course, essentially, we have to build evidence for integration. Evidence can come from the experience. Patients have the experience that I have gotten better, they report to it, and we ask people to go on with that. Doctors who have referred patients to various integrative approaches, complementary approaches, perhaps yoga, Ayurveda, one of them, they find that their patients got better and their experience over time tells us that integration is possible. And of course, it is not just experiences, they have even recorded their experiences as case series, case reports to emphasize that such integration is possible. And more recently, people have even done clinical trials, randomized clinical trials, open clinical trials to demonstrate that a given additional intervention or an intervention which can replace the conventional systems as well as monotherapy have also found beneficial. These clinical trials, another evidence that makes us practice integrative medicine. And not only this, I think the science has contributed to illustrating that integration actually brings in a biological change. The biomarker approaches have come into place, making the evidence stronger, urging us to use integration in our clinical practice. This is an example, although it is not a randomized clinical trial, which shows that yoga practices get depression scores much lower than what it was to begin with. Although I do not want the viewer to confuse this data as a comparison between drug and yoga, but yoga in itself brings down the depression scores in outpatient depressives when it was given. People have also done randomized clinical trials illustrating that yoga perhaps is as good as antidepressant drugs in acutely ill depressed individuals, although another treatment called as the electroconvulsive therapy performed best. Nonetheless, such comparative trials and randomized clinical trials have to be strengthened with multi-center trials, and more recently people have also published what is called as meta-analysis, pooling results from multiple studies, again suggesting that yoga intervention in psychiatric disorders is actually going to be beneficial. Just as much as demonstrated the benefits in depression, we have benefits in a condition called as schizophrenia, a more severe disorder, wherein again a randomized clinical trial, yoga or a wait-listed individuals in those who are attending outpatient, stabilized on an antipsychotic medication. When yoga was added, a part of their clinical syndrome called as cognition, social cognition, it gets better. When I say social cognition, that means this individual now can appreciate emotions in another individuals. He can emote with family members. He is now come back to what his old self was. In addition to, of course, having lost the symptoms of psychosis with the antipsychotic medications that we have given. So you can see the social cognition scores have improved following yoga therapy, whereas wait-listed individuals, they did not improve. This is another clinical evidence which actually urges us to use yoga as a part of our clinical practice in psychiatric or mental health care. We have biological markers as well in individuals with depression. Cortisol levels are higher, and you treat them with any antidepressant treatment or yoga, cortisol levels fall. As you can see here, yoga with medicines or yoga alone, more people lost their cortisol levels. Again, a biological indicator that the disease, in quotes, I would say, has gotten corrected with the introduction of yoga in these individuals. Just as much as cortisol is another evidence biomarker, we have also been able to see in other studies one of the neurotransmitters in the brain actually gets better. And the function of the neurotransmitter is to make us more relaxed. And this can be illustrated by a neurophysiological experiment, which is what is called as the cortical silent period. As you can see here, when you record the electromyograph on the hand, and give a stimulus to the brain using the transcranial magnetic stimulus. After the initial spike of the muscle, for a short period, the muscle potentials become flattened. The period for which it is flattened is an indicator of the role of the inhibitory hormone called as the gamma aminobutyric acid in the brain. The longer is the silent period, the better is the GABAergic transmission that happens. As you can see here, depressed individuals, the blue part, have a shorter period than the healthy subjects, the next saffron one. And you treat the depressed individuals by randomizing into mere walking or yoga. In the yoga treated individuals, the last two bars, as you can see here, before treatment, the values were lower as expected in depression individuals. With the treatment of yoga, the purple line indicating that this cortical silent period got longer and started moving into the direction of what healthy subjects possess. In other words, a biological correction has been possible with yoga. Another evidence to compel us to use yoga in psychiatric disorders, depression, for example. Here is an example where we can see that with practice of yoga in individuals of schizophrenia, the neural networks actually get better. What we call as the default mode network, which, as you can see here in the posterior part of the scan, the yellowish part, with the treatment actually before yoga and after yoga, this area becomes brighter. The practice of yoga makes the neural networks become more coherent, and that also gets their symptoms actually better. So here we are. Biomarkers also compel us to use yoga in psychiatric disorders, severe mental disorders, for example. So yoga now has gotten into some of the treatment guidelines, even international and national. It has become used as a complementary therapy in addition to antipsychotic or antidepressant drugs. It perhaps has a potential to be an alternative treatment as well. We of course have to use some precautions for prescribing a given yoga practice in a given psychiatric condition. However, over time, I think the time has come, just as much as we use a psychologist and a social worker and a nurse in our mental health team, we would probably be using a yoga therapist in our mental health team. That is precisely what the Buddhi clinic is doing. They have another team member, the yoga person, into their complementary and holistic treatment approaches they have. And I compliment them for having introduced this holistic approach in psychiatric practice. I'm sure yoga is one which brings in evidence to be incorporated into this comprehensive healthcare prevention. Thank you very much.
Thank you, Dr. Gangadhar. That was a very interesting presentation showing us evidence of how yoga has worked in certain mental health disorders. I am now going to request our third panelist, Dr. Krishnamurthy, to please give us his presentation.
Thank you, Zubeda, and thank you, The Hindu, for this wellness webinar on the promise of integrative medicine. And I'd like to thank both my very eminent and esteemed fellow panelists for not only sharing their thoughts, but having taken the time to be here with us today, both in Buddhi Clinic and for the webinar. I'm going to talk about holistic rehabilitation, but with a focus on Alzheimer's dementia. Now, just like in diabetes, we have impaired glucose tolerance as the pre-diabetes stage. In dementia, we have mild cognitive impairment as the pre-dementia stage. And this is something that's currently used largely using clinical psychological tools. It does not have any definitive drugs until recently. The advent of anti-amyloid therapies has changed that. However, if you want to take anti-amyloid therapy, you need an amyloid PET and CSF biomarker studies, which are simply not available. And even if one is suitable, the drugs are extremely expensive and also have significant side effects. which means therefore that we have to treat people with MCI in other ways rather than only the new technologies and the new drugs. Now, we have to ask ourselves, why should we talk about integration of care? And we must acknowledge that advances in science are slow. The drugs for dementia that I've been talking about have been in development for 2 decades. Even once they come out, the advances take a lot of time to come to the developing world. And we have to acknowledge that. There is a 5-way gap in healthcare. Availability of care, accessibility, even if it's available. One of the factors that comes in the way of accessibility is affordability. Then what is available? Is it acceptable to the person? And is care being delivered in an accountable way? So these things actually are the barriers to good care. And while biomarkers and personalized medicine for Alzheimer's disease and mild cognitive impairment will take a decade to mainstream in the West, they may take a second decade to become available in select centers globally and a third decade to reach the developing world. Maybe the time will be shorter, but we are still looking at several years before a wide spectrum of people become eligible, even if diagnosed. And currently, all the treatments we have from a pharmacological perspective are drugs that are symptom relieving. And this we have to keep in mind. So how does integration help? It taps into one key barrier, acceptability, by bringing to the sufferer treatments that are closer to his or her concept of healing. We live in a nation that has celebrated Ayurveda and yoga. Surely including them as part of a care paradigm will make a huge difference to the acceptability of the person who is suffering from mental health issues. And I'm talking now, of course, about dementia and mild cognitive impairment. Integration focuses also on the reduction of suffering. So what impairs people when their activities of daily living are impaired or their quality of life is impaired? Improving these things makes it better for the person. And that's very important. And the third, families of people who are suffering with mental health issues, including dementia, suffer themselves. And integration helps the family feel involved and participate in caregiving. And this gives families a sense of satisfaction. We heard from Professor Bhushan how it is so important for not allowing elders to become lonely. And I think in India, we have this huge advantage of the family as a social support system in old age, which is still very relevant and very important. There is a lot of evidence today that multidisciplinary care or transdisciplinary care improves diagnosis, improves the speed of response, improves clinical care quality, and improves behavioral and psychological symptoms in dementia, which are a huge problem. It also improves caregiver quality of life. And I think there's published evidence to this end. Also, we know that non-pharmacological approaches, several have been recommended for dementia and now very widely used. This is from the Royal College of Psychiatrists, a list. We also know, as Professor Gangadhar just showed us, that yoga makes a difference to the brain physiologically. There is evidence that non-pharmacological treatment changes brain activity in patients with dementia. And indeed, non-invasive brain stimulation techniques do the same thing. So, one question we have to ask ourselves, if we have someone who's affected in our family or we ourselves are affected, should we not reach out for some of these solutions that can make a big difference to us as human beings, make a difference to our outcome as human beings, and as we were saying, reduce suffering, improve quality of life, improve activities of daily life. Now, multi-component and multidisciplinary care helps people maintain their activities of daily life and quality of life. It prevents institutionalization, which is one of the big reasons for loneliness. To put people into old age homes, they definitely are lonely. It encourages family care and it helps us care for caregivers, all of which are very important public health goals. The West has learned that, and it's teaching us that the economics of dementia, it is not sustainable for governments and for public health services to offer institutionalized care to everyone. Family-based care is much more sustainable, and this is what research is also showing. It's better for the sufferer and for the family.
And in any case, even if you have the most modern treatments which are based on biomarkers, this will not replace caregiving. Caregiving is required in order for people to be better, and that is something we cannot do. So, what do we integrate? We integrate a whole range of non-pharmacological healing systems, including healthcare traditions that are locally available and culturally acceptable. It is possible, and this is the work we've been doing in Buddhi Clinic, to create seamless models that have inbuilt an element of patient choice. And one of the things that we have to keep in mind here is that people feel much better when they participate in choosing their treatments, and autonomy is a very, very important factor in helping us help people. It's also possible to bring together the best of modern science and the wisdom of ancient healthcare traditions, is what we've been finding. And what you've been hearing also from both our eminent professors, it's also possible to track carefully outcomes in healthcare. We were recently at the World Congress of Neurorehabilitation, where all the discussion has shifted to collecting real world data rather than carry out clinical trials for rehabilitation. So this is something that I think is extremely important. So what are the good qualities of a good integrative medical practice? We need detailed assessments and diagnostics. Definitely, it's very important. It's the cornerstone of good medical practice. We need the multidisciplinary approach, but multidisciplinary, everybody under one roof, is even not enough. It has to be interdisciplinary. People have to talk to each other, and people have to discuss the caregiving that they are doing with the patient. There needs to be holistic impact, and we need to monitor outcomes and be able to show that the person is doing better. You saw in the graphs that Professor Gangadhar presented how we are able to show that people have improvements in their symptoms and the scores are coming down. This is extremely important. At Buddhi Clinic, we have a whole house of holistic medicine, Ayurveda, yoga, naturopathy. We have a number of pressure techniques, acupressure, reflexology, we have acupuncture, we have conventional rehabilitation, physical, occupational, speech therapy. We prescribe medication like all good hospitals do. And then, of course, we have a whole house of neuromodulation. And for this, we also have a team approach, which is extremely important. And what also has made a difference for us is to be able to have an electronic medical record system as well as enterprise resource program that supports the care, so that we are able to track, monitor, and understand how the care is proceeding. And we found all this extremely helpful. This is an example of someone, the kind of care we integrated for the person in the intensive phase. We gave him physiotherapy because he had medical comorbidities and pain. We gave him psychological therapy for cognitive retraining. We gave him a whole house of holistic care therapies, and we also, which came from Ayurveda, naturopathy, and yoga. And we also gave him brain stimulation using TDCS combined with normobaric oxygen. In the long term, maintenance was with these other treatments, acupressure, reflexology, yogasanas, chanting, and prayer. And working with this individual in this way, we were able to improve his Addenbrooke cognitive examination scores from 62 to 73 and maintain them for 24 months. Unfortunately, they dropped when he got a very bad viral infection, which affected him significantly, which is something that happens to people with mild cognitive impairment and people with dementia. But these approaches have got potential to help people, and that's something that we need to keep in mind. There are other things that we need to do for mental health. Across the lifespan, we need to care for the caregiver. If you have a child with autism, an elder with Alzheimer's, an adult with schizophrenia or bipolar, and you're the caregiver, you need hand-holding too. We need to consider holistic well-being. Loneliness is bad, so we need to consider socialization. We need to consider supportive counseling and opportunity to talk. And as Professor Bhushan was pointing out, prevention is the cornerstone of good health. And therefore, what you eat, what supplements you take, what lifestyle you lead, what kind of exercise you do is extremely important too. All these approaches have huge potential to help mental health. This is not just in India. We've heard repeatedly from both the other esteemed speakers that there is a case for traditional and holistic systems the world over. People choose traditional and holistic systems on their own, and which means that we need to listen to people when they say that they would like integrative medicine rather than just one kind of medicine to treat them. So good care and good integrative health can make a difference. It should combine the best of science with the best of holistic and ancient traditions. It requires multidisciplinary teams that talk and work with each other. It needs to be process-driven and rigorous. We need to be able to take care to the doorstep. This is extremely important because many of our patients live in far-flung places or indeed are not at all well and cannot come to clinic. And there need to be regular assessments to track progress. So we do philosophically and pragmatically encourage harmony in healthcare. Traditional systems and modern science must come together to help people enhance and maintain their potential. And with that, I will say thank you so much for your attention.
Thank you, Dr. Krishnamurthy, for that very clear picture. I have a lot of audience questions, so let's get straight started. One of our first questions from one audience member is about, Dr. Krishnamurthy, if you could address this. I wish to know how the inherent conflicts in a multidisciplinary approach, say between allopathy and alternative systems, are resolved.
I think we understand the concerns about conflict, and this is one reason why, rather than care happening in multiple locations, care happening in an integrated way under one roof with people that interact with each other will make difference. Of course, there's another thing. In fact, today's workshop, we focused quite a bit on it. It's very important for us to approach safe practices. So all healthcare practices have to be safe for the person who's receiving them. And of course, there needs to be cross-disciplinary talk, but we shouldn't start interfering with each other what we are doing. We need to take the best out of each system when we integrate. So yes, it's possible to integrate, but with a good understanding of what can go wrong, with a good understanding of the individual we are treating, and with I would say complete agreement on what the outcomes we are seeking. Both the specialists who are treating the person and the person themselves need to be on the same page when we do these things.
Thank you, Doctor. Dr. Gangadhar, if you could take this since you spoke to us about yoga. One question is about how yoga requires the patient follow the instructions of the trainer. Not all patients, particularly those with behavioral issues, are likely to be cooperative. Would a drug regimen also be necessary in this case?
For yoga and
Should I repeat that, Doctor?
Yeah, well, is it about whether patients with mental health concerns can participate in yoga actively?
Yes.
Yeah, you made a very, very important question. Traditional yoga gurus say that your mind should be good to practice yoga. I do agree that we make persons to understand some very simple practices of yoga to begin with, as they are able to practice it, and more so when they are practicing it with other people, they started getting better and they started feeling connected, and over the course of time participate in more and more of these programs. And that is the time when they will be able to actually be mindful of yoga. A mere physical practices alone will not be enough. Physical practices which they are doing, when they are doing, they have to be mindful about each of those practices, the sequence of breathing and so on and so forth. And we have found that in the initial phases, they need to be handheld. We have to teach them, and after a couple of sessions, they're able to practice it better. And more often than not, at least in the severe mental disorders, they are given antipsychotic or antidepressant drugs. They get a shade better and then start practicing yoga. In a milder forms of the illnesses where drugs action is nearly not so important, yoga has produced benefits. Although we give the choice to the patient to avail yoga with or without medicine.
Thank you, Doctor. Professor Bhushan, if you could address this. One audience member is asking if there should be replications of the models that are there at NIMHANS and maybe even at Buddhi Clinic at other places as well for integrated care.
Yes, it is very important because when we develop a new methodology or new approach, we first do pilot. And we consider these as pilots, like NIMHANS has started integrative medicine department. Now, after NIMHANS has started, most of the AIMS in India, they have started integrative medicine departments, Like now, here in Chennai, the Buddhi Clinic has started integrative mental health care. And already they have 4 or 5 more centers where it has been tested. So now this model is very well tested model. And why only certain number of people or certain regions should get benefit from this tested evidence-based intervention. So it needs to be opened for more and more people. And I can tell you that this kind of a model actually for mental health, integrative mental health, the world needs it, because I have not seen such kind of a model where traditional medicine and conventional medicine are so well integrated. So even West would need it. West is now looking after various interventions, including yoga, tai chi, and all, and they are all doing it here. So this kind of a tested model must be replicated outside to give more and more benefit to people.
Thank you, Professor. Dr. Gangadhar, there's another question about the yoga part of it. One audience member has said that the stress and depression that you talked about, and it's about how yoga helps in this. She has also asked for the need for more studies to incorporate yoga and bring in more awareness about its use in mental health care. Would you say that more studies are required as well?
Yeah, the research has been going on. In fact, there are several granting agencies they have given research, and some researchers have actually reached given results to increase the strength of practice of yoga in these conditions, and guidelines have started using it. So I think more research, the better, of course. And there are some challenges in research in yoga. For example, a double-blind trial with a medicine gives an identical capsule and a true drug. And you are not going to have such research possible in treatments such as yoga. What is the placebo for yoga? What is it, the identical looking for yoga? So these are all the challenges. But amidst challenges, the biomarker research that has shown that yoga produces a biological change which can be seen as a good evidence of yoga effects producing these changes in these individuals. And of course, multi-centered research is what is required today. And my colleagues at NIMHANS have been able to succeed in doing a multi-center research between Bangalore and in Chennai, been able to demonstrate the same effect of cognition scores, social cognition scores, getting better in already treated schizophrenia patients who have been given yoga or a waitlisted group of control groups. So research is getting stronger and the evidence also is getting stronger, and we cannot wait for that ultimate idealistic randomized clinical study which happens with the drugs. I think clinical practice has shown yoga can be incorporated and integrated in mental health care.
Thank you, Doctor. Dr. Krishnamurthy, there's one question about the solutions to reducing side effects of taking psychiatric medicines, as almost all antidepressants and antipsychotic medicines have a lot of side effects. Is there a use for alternative forms of medicine here?
So what we do find is when patients engage in an integrative health program, their need for medication naturally reduces over time. So for example, because you're doing Ayurveda or because you're doing yoga, when your sleep improves or your digestion improves, then the need for medication to make you sleep also comes down. So in that way, and this has been shown in other conditions. It's been shown with hypertension, for example. It's been shown with diabetes, for example, that when you use alternative medicine treatments alongside regular treatment, over a period of time, the multiplicity of regular medicines that you take will come down. And of course, we have other technologies today. For example, for depression and say acute psychosis, we have non-invasive brain stimulation techniques. They have a very similar effect too, that they are able to reduce symptoms, and when symptoms reduce, the need for medication comes down. So I think on the whole, the way to look at it is that if you have significant symptoms, you're needing multiple medication, you're still not getting the desired effect, then you should be looking at what else can be added. Professor's elegantly shown you that yoga can help you. Conceptually, we know very well, and there is some research that shows us that other systems of medicine can help you. For example, in dementia and behavioral and psychological symptoms, there is research that shows that Tai Chi can be helpful. There is research that shows that group activities can be helpful. So at the end of the day, integrating those approaches, I think, is extremely valuable and definitely worth considering for the individual or the family.
Thank you, Dr. Krishnamurthy. Professor Bhushan, if I can request you, there is one question about integrating this sort of approach at the primary level, say at the GP level or the family physician level, because the audience member says this is not something that would be an automatic recommendation from your family physician. Is that something that is required?
Primary care.
Integrating into primary care.
Yeah. Integrating in primary care is, I think, very important for us in India because globally and even at the World Health Organization level, the focus is coming on primary care. Because many problems, if you are able to address them at the level of primary care, the progression can be controlled. And I think at primary care, if these interventions, simple interventions, non-pharmacological interventions, diet-based interventions, behavioral interventions, if they start coming up, it will have a huge impact. It will have a huge saving also of resources. So primary care interventions is very, very important.
Thank you, Professor. We have only a couple of minutes left, so I'm just going to quickly address a couple more questions if we can. Dr. Gangadhar, you talked about patient acceptability and how that was important in terms of alternative and complementary forms of medicine. There's one patient question about how sometimes people with mental health disorders are not even willing to seek treatment.
It's true that in severe conditions, they may not be volunteering to get treatment. But today, the awareness has increased. The number of people seeking out for help actually has increased. No wonder the government of India has launched what is called as the telemanas. People have already, in a couple of lakhs, have already called up these lines to get help. So the awareness is increasing. Concurrently, the awareness that interventions such as yoga are also beneficial in some form or other is increasing. Today, what we used to have, for example, in Nimmans, I recently retired from Nimmans though, when the services of yoga started, there used to be 1 or 2 patients coming for yoga as a treatment in a week. And today we have as many as about 20 to 40 people coming every day requesting for yoga as a treatment, or doctors having referred them for treatment. So the awareness for treatment for psychiatric illness is steadily increasing, and the awareness that they should seek out treatment which empowers them is also increasing. Yoga is a case in example.
Thank you. Last question before we have to sign off. Dr. Krishnamurthy, if you could take this. There is one question about the importance of communication between, as you talked about caregiving and how that is very important when it comes to mental health disorders. There is one question from the audience member about the need to communicate with both the patient and the family taking care of him, and how that perhaps is not being done as well as it should be.
I think all mental health professionals are very aware of this, that there is a need to communicate with both patient and family. There are two types of problems. One type of problem across the board is time. Unfortunately, most clinics, especially in our public health system, are extremely full. And time is something that's not always available for such communication. It doesn't mean it should not be done. That's one of the difficulties I think professionals face. But there's another, which is the ethics of communication. If I'm dealing with an adult with mental health symptoms, I cannot discuss the symptoms with other people in the family, however close, except in very specific circumstances or unless I have explicit permission to do so. And very often people with mental health issues are not comfortable with information being shared with a parent or a spouse or somebody else. So this also can give the impression that the mental health professional does not want to engage with the caregiver. That's not true. We have to follow the ethical limitations of what we are doing. It's extremely important for us. So I think that there are these other factors that are to be kept in mind. But on a positive note, I think when we get people to engage in practices like yoga or practices like group activities, it opens up the possibility of better communication. And I think over time, the person themselves will share more information or welcome the caregiver into the session, which is, that is the most ideal thing.
Right, we're just a little over time, so I think we should wrap up now. Thank you very much, all doctors, and thank you, participants, for joining us today for this webinar. Thank you very much.
Thank you so much.
Chat box, can you download and keep it? Okay, that's it.
Yeah.